I'll answer these questions. I have worked in 3 different countries. Huge taxes, about 50 to 60%, but 2 basic necessities are taken care by the government, which is primary education up to grade 12, social democracy, but people are insured. Like everybody has their own private insurance through which you can pay for it. Okay, so the point I'm trying to make here is, all this technology, starting from R&D to manufacture to delivering it, all that comes at a cost. So if we are saying that we want to do it absolutely free of cost, it cannot happen without government aid and government support. And once that falls into place, we will be in a better position to collaborate, because it cannot be done at a negative cost, right? Even if we want to do cost to cost, for the basic technological things, we need support from the government. So that's where we stand. Have I answered your question? Yes.
What is the cost of diagnosis as a practitioner all across India? And
well, if I'm asked to, I would. But somebody, like I said, we do need awareness. In urban cities, I guess there is a lot of awareness, but in rural areas, like you just spoke, there isn't. And the thing about cancer, as we all know, is early detection is the key, because the later it is, that's our only fighting chance, early detection. And a lot of women are not even aware. I mean, how many of us are really doing a monthly self-examination, for example, let alone an annual clinical examination or a mammogram? So these things have to come out, and we have to speak about it and spread it, and maybe we'll save a lot of lives like that.
This for Twinkle, Khanna here. What's the cause of this breast cancer? Can you?
What is the cost of breast cancer?
What's the reason?
It's your life, if it,
What's the reason?
Cause of breast cancer. Well, it's genetic, and it's genetic, environmental. They haven't really got a cause, because if they had a cause, they'd have a cure, and we don't have a cure.
It's a multi-scientific cause. We cannot point out what the cause would be. There are the risk factors, and the risk factor could be one, yes, definitely a family history, and the other would be the other factors like a hormonal factor, obesity, the external factors, all the contribute. One cannot find out if yes, the one point is sometimes there is a no risk factor, you find this thing, but the risk factor involves like the obesity, family history, the contraceptive pills that need to be taken care of.
So Dr. Shilpa, as you said that in other countries like Canada, there is a social democracy which is not in India.
Correct.
So what sort of government assistance are you looking for so that this awareness can be brought in much more proper way?
Any kind of government representation has been made in order to further this collaboration we're talking about?
A fair amount of work is being done at Tata Memorial Hospital also. So that's one place where they make mammograms available at subsidized costs, and they are doing their bit by making that a starting point. So if there is an aware patient, if there is a needy patient, that's one place the government has made available where they can get things done. Having said that, I'll take this. I'll go back to the point where Twinkle was discussing. Everything about cancer is about early detection. And what people don't understand, sometimes people are aware, sometimes they even know that I have to get a mammogram done, but oh, it's uncomfortable, or maybe for some other time. They do not know the outcome from it. If a breast cancer is detected early, the treatment required is just small surgery, which means just the lump is removed, and radiation therapy. That's it. And the 5-year disease-free survival in these kind of cancers, early detected breast cancers, reaches up to 98%. 98% of the times, if the cancer is detected early, the treatment is different and the survival is fantastic. In locally advanced breast cancers, everything changes, because every breast cancer is not the same. Some breast cancers are less aggressive, while there are others which are far more aggressive. So no matter how much treatment you give, they don't respond well to chemotherapy or any other therapy. Plus, the treatment required for locally advanced breast cancers is chemotherapy followed by surgery, which involves mastectomy, removing the breast, and radiation therapy, which means for the time that they are going through the chemotherapy, there is hair loss, there is overall different, it affects the entire system. And then the final outcome, 5-year disease-free survival, is about 50%, which means 50% of the times patients succumb to the disease. So therefore, having this knowledge, having this awareness that whatever it is, we have to get it detected early, will prompt women to reach the doctor in time, okay, or prompt women to get that.
I would not mind a painful examination of 4 seconds if it is going to add 10 years to my life.
What is the right age that you should start off with the tests? What age a woman should start, and what is the frequency they should be doing this test?
That's a very good question, you know. Yeah, so the starting age is 40. Every country has its own recommendation and guidelines. In the United States, a screening mammogram is started at the age of 40 and an annual screening mammogram is done.
What was the first time that you had done a mammogram, if you have done it?
I have a bit of a family history, so I think I was 38 and I do one annually because I've lost 2 members to breast cancer. So
Twinkle, do you feel there is less awareness in India about breast cancer as compared to other countries like US? Like, do you feel we are shy to talk about it?
I think that at this point things are changing, and there are a lot of events, a lot of awareness, but I feel it's more in urban areas. Like in rural areas, I feel that there's a total lack of knowledge and understanding.
This kind of technology, is it the first of its kind, as compared to technologies used currently in India? Is it the first of its kind which has been introduced? The
3D
tomosynthesis, mammogram
Yeah,
tomosynthesis?
3D tomosynthesis. It arrived in India around a year or 2 back, and some of the corporate hospitals in Mumbai started getting it. With Fujifilm Innovality, it is the first in Mumbai that we have installed.
So there are 10 machines.
Point in time. So this is very, very important actually. For detection of breast.
Well, see, what happens is, think about it like this. Breast is a 3-dimensional structure which we are compressing between 2 paddles and obtaining a 2-dimensional image. Okay, so everything on top of it can hide it. Okay, so with 3D tomosynthesis, what we do is we obtain multiple images of the breast and reconstruct them. Okay, more or less like you can say like a CT image, like a CT scan. Therefore, we are able to see slice by slice by slice. There is no problem of superimposition.
You view this in
There are special monitors available. We have these Totoku monitors in place on which we actually view those multiple images. Like one study, like I said in my talk, government is not showing interest, but why it is lower on the priority list is what I said.
So, I mean, so that's the kind of, means talking about tuberculosis and the kind of, about this,
For obvious reasons.
polio and all that, the
Yeah.
kind of awareness is being spread. So,
Yeah.
do you think, are you people going to suggest government that such kind
A lot of diseases that are happening right now. You've got a wonderful sense of humor that we keep on seeing in your book as well as your columns. Now, what would you just say to all the maybe patients or maybe caretakers who are taking it, that how they can possibly, because I think that can be a great way
I
of...
don't want to say it frivolously, but I guess I would say a feel a day keeps the doctor away, right? So if you do your own self-examination, then you're one step ahead of the doctor, and probably you're aware and you don't have to go so quickly. Stress is a big factor, but I really don't know. There is no direct correlation that they have found that breast cancer is caused
I'm
because
saying for
of
diseases
stress.
in general, I'm not saying specifically for breast cancer.
Well, I guess you just have to laugh a little bit and shrug your shoulders at what you think are your burdens and walk on. What else can I say?
Yes, stress is a factor is coming up now. It's coming up. Recently it was not in the paper, but now it's coming up. Yeah, it form a backbone. I mean, a few years down the line you will find it. One thing I need to stress here, we are talking about every early detection, but what aids it? One is cure it. Number 2, earlier the woman come to the later stage, advanced disease, and they has to have a mastectomy, losing of one breast. That's a negative psychology on the part of the female, and social life is completely lost. Entering, going to events, everything. Early detection means small surgery, they have a normal life. This makes a positive impact and cure it gradually increasing with this attitude. It helps by a technology. So one thing is not possible. So technology and science has to go parallel.
We'll just take one last question.
Thank you.